I know there are quite a few parents here. Namaste, parents. Quite a few TSUS parents also here. Let me introduce myself. I'm Rizwan, head of Shriram Academy. In fact, I connected with Dr. Parag 2 days earlier about the hMPV virus. We have started getting a lot of queries from parents. They want to know more information. Unfortunately, we speak about
Myself,
ignorance is bliss.
I'm Rizwan, head
When
of Shriram Academy. In
okay,
fact, I connected with Dr. Parag
I'm
2 days earlier
I'm sorry, I don't know why this is happening.
about the hMPV virus. We have started getting a lot of queries from parents. They want to know more information. Unfortunately, we speak about ignorance is bliss. I'm Rizwan, head of Shriram Academy. In fact, I connected with Dr. Parag 2 days earlier. I'm sorry, I don't know why this is happening about the hMPV virus. We have started getting a lot of queries from parents. They want to know more information. Unfortunately, we speak about ignorance is bliss. I'm Rizwan, head of Shriram Academy. In fact, I connected with Dr. Parag.
Is it, excuse me, sir, is someone is open their YouTube?
They want to know more information.
Excuse me, sir. Yeah, is someone is open their YouTube? Yeah, please, because now we are able to see the things in the loop. We are hearing that in the loop. Yeah, now it looks okay probably. Am I audible, parents?
Yes, you are audible.
Okay, great. Yeah, is someone is open their YouTube? Yeah, please, because now we are able to see the things in the loop. We are hearing that in the loop. Yeah, now it looks okay probably. Am I audible, parents?
Yes, you are audible.
Okay, great.
Yeah, please, something is open their YouTube.
Yeah, please, because now we are able to see the things in the loop. We are hearing that in the loop. Yeah, now it looks okay probably. Am I audible, parents?
Yes, you are audible.
Oh, everybody will join again.
Yeah, please, something is open their YouTube.
I guess you can re-log in, log out.
Parents, please rejoin it. I think so. There is some glitch.
I guess you can re-log in, log out.
Hello.
We'll do that, Dr. Parag. We'll log out and log in again.
Now it's looking okay. Parents, please. No.
No. It is.
Okay.
I'll leave and join.
I guess you can re-log in, log out.
Reached out to us. They are quite concerned about the outbreak of, or if you can call it outbreak, of hMPV virus, and they're not sure. We get lots of news from the media outlets, which actually some of us feel they're exaggerating things. So and it is natural for us, all of us, to feel worried about our children's safety, our safety. So it is very, very important that we are aware of what this virus is, what are the implications, and how we can actually safeguard ourselves. So we reached out to Dr. Parag 2 days back, and he was kind enough to spare his time with us today. And in case if you do not know, Dr. Parag is the clinical director of Pediatrics, head of Pediatric Intensive Care Unit at KIMS Cuddles. So I'll not take more time. Dr. Parag, thank you so much once again for your time. So if you can just talk about the virus, and later, of course, we can take the parents' questions as well. And in case if they want to know what the schools are planning to do, TSUS as well as TSRA, we will share that as well. Please go ahead, Dr. Parag.
Thanks, Mr. Rizwan, and I welcome all parents. So yes, I'm getting.
Sorry to interrupt you, sir. Are we recording this meeting by any chance?
Yes, it's on.
Okay.
It's recorded, and it's on the YouTube also.
Fantastic.
Yeah. So what has happened is, yes, it is quite. Since last 1 week, I got a lot of calls in and around Hyderabad and some different states about this human metapneumovirus. So I'll first talk. If you see the news which is coming into the media, it is mainly media driven rather than a scientific evidence driven. There are no doctors coming and saying, okay, you buckle your seat belts, now things are going to be bad and all those kind of stuff. So at this moment, we'll talk a little bit about human metapneumovirus. Okay, this virus, if you see, first kind of 2001, 2004, you got this virus first time in Netherlands, and then subsequently over the time kind of spread all over the places, continent. So this is not a new virus. Human metapneumovirus is not a new virus. It is there in the system since long time. And we have been in our hospital, keep on doing this viral PCR. And if any child comes with the cough, cold, pneumonia, so we keep on doing this viral PCR, and occasionally once in a 2 months, we see this virus. So this virus is not something which is new to Indian continent or India country. It's not. It's there. It's there. The human metapneumovirus is there. And now the second question parents are asking, are we should be too much worried about this human metapneumovirus? So second thing is this, most of the time, this human metapneumovirus causes mild illness. So it's like a flu-like illness. There will be a cough, fever, mild grade fever, coryza, some sneezing, and upper respiratory tract infection will be there, and they will recover in the 4 to 5 days. Very rarely, out of 100 kids of human metapneumovirus, 2 to 3 kids can have a pneumonia. And that is also most of the time, it is not bad. These are the kids probably not going on any ventilator or not requiring any invasive oxygenation and all those things. So they are pretty good, except few kids who are immunocompromised. What do you mean by immunocompromised is those who are having chronic heart conditions, chronic lung condition, frequently hospitalization, or from birth, they don't have a power to fight with the infection. We call it as a primary immunodeficiency. These are the kids, they are more prone to develop bad infection or bad disease related to human metapneumovirus. So whatever the cases, I think so in context, if you see the media, around 10 to 15 cases are there. And most of the cases who's managing the cases are in and around my friends. So they are not having a major, none of them are on ventilator, nothing. So things are quite controlled at this moment. And again, as I'm telling you, it's not a new virus which was not there into the system. So it is basically a same virus. Now, does it mean that we are good, we are safe, nothing to be done? No. So what we can do, we can be a little bit vigilant. What do you mean by vigilant? Means same thing we did it during the COVID, but we all did the things very, very late. So what are the normal things? If kid is having cough and cold, so yes, you can think like that. The child is having a cough and cold. So it's a social responsibility to keep the child at home, so that even if it is an other virus, like human metapneumovirus, RSV virus, the rhinovirus. I'm going to talk about the other viruses also. So probably there is a good chance that the other kids might not encounter this virus. That is one thing. Same thing what we did, kindly advisable to use a mask. It is not a recommendations from the ministry at this moment or anything, but if you really wanted to protect your child, you don't want your child to have other viral infection also, you can kind of ask them to use a mask, whatever, whenever it is possible. And other things is cough hygiene, what you call hand washing. Those are all mandatory. And I know about TSUS and TSRA. There is a very good ventilation in the classes. So that is one of the things which we followed during the COVID time also. So these are the common things you can do, and none of these kids are getting worse. If you ask me, are you worried about human metapneumovirus as a doctor or as intensivist? Probably there are other viruses we should be worried, which are more dangerous than human metapneumovirus. And we live with these viruses since last many years. So what are these viruses? Influenza, which is causing, and we have a vaccination available for influenza. Even if you take a vaccination for influenza, remember that this vaccination is not going to prevent you from a normal cough and cold related to flu virus, but it is going to prevent you from bad flu, like a bad pneumonia, bad brain infection related to flu. Then we have other viruses, we call it as an entero and rhinoviruses. These are also there, more common than human metapneumovirus. Then there's another virus called as a RSV, respiratory syncytial virus. That is also very, very common virus currently in and around the system. And there is another virus we have seen probably, I would say 4 or 5 months back, adenovirus. So these 4 viruses are much, I would say 100 times common than the human metapneumovirus, which are there into the system. And probably most of these viruses are not causing much of a major issue, but they are still much bad than the human metapneumovirus at this moment. So what if you ask me kind of if we get some information, so we are talking about this virus is coming from China, there are bad cases detected in China, is nothing like that. As I told you, this virus is still there in the system in India. Now, when we should be worried, so if we start getting some knowledge or start getting some information from the Chinese counterpart or in and around India that this virus is mutating. So what exactly mean by virus mutation is there are 2 mechanisms for any virus, which we have seen in COVID. we call as an antigenic shift or antigenic drift. So antigenic shift means because of some reasons, suddenly the framework of virus is changing suddenly and it's becoming more virulent or causing more trouble. That is called as an antigenic shift. And drift means slowly, there are some genetic changes happening into the virus and a new virus is coming into the picture. If those things happens, those things get reported, then we should be a little bit worried. And even if that situation, if those antigenic shift and drift happens also, we are not sure that it is going to cause a pandemic or epidemic. We don't know how it's going to, the way we had it in COVID. At this moment, there is no evidence, clinical as well as virological in and around the world, that there is an antigenic drift shift or it is going to cause epidemic or endemic at this moment. So we should be okay. We should be vigilant. We should wait for the information. And simultaneously, there are few things, as I said, social distancing, cough hygiene, make it sure that keep the kids at home if they're having cough, cold, and fever. And here, mask is advisable, ventilation, all those things we are taking care. So this is a brief about currently what exactly happening. I had a word with almost every state. Nobody is kind of supporting any major intervention at this moment. You take a Delhi, we had a Kerala counterpart, Gujarat, all those things. I had a long chat with yesterday with them, most of them. So we are kind of in control situation at this moment. So with this kind of an information, I think so we can individually answer the question so that we should be able to kind of completely take care of their doubts.
I think, Dr. Parag, one is because we have been following news, right? We get this news that we have detected 2 cases in Bangalore and 3 in Hyderabad and 1 in Delhi. I think that is making parents worried.
I do agree. And most of these cases, if you go into the clinical information of these cases, they are stable cases. And let me tell you, there are 2 ways of detecting this human metapneumovirus. One test is called as the way we did a COVID test. We take a secretion from the nose as well as throat. We call it as a nasopharyngeal swab. And we check for the battery of investigation. So what we commonly do in our hospital in KIMS Cuddles, we check for 11 viruses, and one of the viruses is human metapneumovirus. Again, if you're doing a biofire, there is a very standardized method of detecting this test. So then it is more sensitive, but there are different methods available. We call it a multiplex PCR and all those things. And remember that if you are positive, like a COVID, if you are positive for human metapneumovirus, does it mean that you are having a disease? No. It's still possible at this moment. I might be having a human metapneumovirus in my nose, but I'm okay. Or you are not having any symptoms, still human metapneumovirus can be positive because that could be a dead virus. So it's not like that only doing a viral test is important. So we should have a clinical context. We are doing a case, and most of this clinical context are really mild, and there is no medication available for human metapneumovirus, no fluid, nothing. So basically, most of the time treatment is symptomatic. So whatever news you are seeing, it is driven by media, not by the scientific knowledge, not by the doctors. If you see, nobody's coming onto the platform and saying some things are worse, things are going to get worse. So nothing like that. It's all media driven at this moment.
Okay, thank you for the clarification, sir. I think the parents are mainly concerned about the children more than, let's say, the adults. In our case, TSRA, we are taking our grade 4 children to a camp to Bengaluru in January. So do you recommend any kind of precautions that we need in case, not just for the children, but generally for air travel? If the children...
Sir, good question. So whatever we should follow, and I've been following that not very commonly, but most of 80% of the time. So yes, definitely make it sure that whoever kids is coming with you, they are infection free in the sense they are not having cough, cold, and fever. If they are having, they can stay at home. Make it sure advisable to use masks during the flight and crowded places, because the most crowded place you're going to see is the plane itself, because rest of the time you have a good ventilation. So make it sure they're having a good mask and cough hygiene. So that should be okay. Because again, I'm saying that there is no travel advisory at this moment, and it is not reached to pandemic or epidemic kind of a things. So at this moment, yes, if you ask me, that doesn't mean that I am actually promoting you can travel in and around. What precaution should be taken is make sure that child is healthy, hydrated. Again, you can give a bottle of a sanitizer so that using frequently. And fourth thing is mask. Keep it a mask so that the cross infection is also less.
Yeah. Thank you for the clarification, sir. We have Mr. Sunil Kumar here, who's Chief Manager Operations. Thank you for arranging this, Mr. Sunil. Can you please read out the questions parents have posted?
Sure, sir. Thank you. Other than cough, cold, and fever, what could be the serious implication due to this virus in kids or adults?
So, if you ask me, maximum patients get cough, cold, and fever because this is basically a respiratory virus rather than other viruses. So, example, I said influenza. Influenza virus is known to cause trouble into the lungs, liver, brain. Human metapneumovirus is not like that. It is mainly have a predilection towards the lungs. So, usually it causes cough and cold. And in a very rare scenario, as I said, 2 to 3% of the patient, it can cause pneumonia. So very specific virus related to the respiratory tract. So you'll have a cough, cold, fever. It could be asymptomatic also, the way we had a COVID, that you might not get a cough, cold or anything. You might get a little bit of a viral symptoms, very mild symptoms, and you might recover. So all kind of a natural infection you might have.
Got it. Is there any age-prone people that are more severely getting, trying to affect children?
So what happens is now in our medicine, most of the time what we say kids less than 1 year of age and adults more than 60 years of age, they are more prone for infection. The reason is kids less than 1 year of age, they are still mounting infections because 6 months they are protected because of the mother or mother milks. And after that, they have to develop their own antibodies. So any child less than 1 year of age or any child more or any adult more than 60, because after 60 years, the memory cells or memory of infection goes down. So in that situation, what I would say is these are the two groups which are more infected. But as such, any respiratory infections are common less than 5 years of age because they are still developing their memory related to the respiratory infections. So I would say less than 1 year, you should be very cautious. 5 years, okay, moderate. And anything more than 60 years old, very cautious.
Got it. I have one more question related to, does hMPV have any specific seasonal patterns?
So most of the viral infections are common during this season. The reason is this is a season where there is a lot of changes related to weather. There are a lot of changes related to the pollens. And you know that the precipitation of this smoke particles or dust particles are more. So that's why we get a more respiratory infections during this season. So I would say winter season is the commonest season we see human metapneumovirus or any other viruses. Usually unlikely in the summers. The reason is the temperature is very high. So there is a less likely this viruses get thrive outside the patient's body. So mainly winter season is the commonest. And for any respiratory, there is only one respiratory infection we give vaccination, which is basically influenza or flu, which is very standardized all over the world. We try to give this vaccination around July, August, so that they develop the antibodies titers to take care of the winters. And I could see simultaneously there is vaccination related to human metapneumovirus. So there is no vaccination available for human metapneumovirus. It is not like that. If you give flu vaccination, it will prevent you from the human metapneumovirus. So there is no vaccine available.
Got it, sir. So people with existing chronic conditions, how bad is it for them? How bad is it for them? Yeah.
So for kids with the existing chronic conditions, yes, this virus can be really bad. But as I told you, you should be more worried about influenza, rhinovirus, RSV than human metapneumovirus. You should be worried about this virus because these viruses are probably, I would say, 10 times more common than a human metapneumovirus and can be bad. So in this scenario, what I would say is strictly follow hand hygiene, mask, don't go to the crowded places. This is not to prevent you from human metapneumovirus, but all any other viral infection. At home, strongly suggest reverse isolation for such a kind of a small kids. Reverse isolation means probably it is very uncomfortable for child to stay with the mask inside the house. So adults can use a mask so that they are not actually giving infection to their kids. What happens is now these kids get exposed to school, but there are a lot of other parents. So let it be a child with the 1 year old age group in the home. They usually don't go outside. So it is us who go outside, speak with many people. We have these viruses in our nose, but we are not getting infection because we have some memory related to these viruses. And then what happens, this virus stuck to your nose and stay there, not causing any infection in you or not causing any symptoms in you. And when we come home, start kissing the kids, so probably we transition these viruses to them. This usually common story for less than 1 year of age. So we gave them viruses, or you have an elder sibling at home who goes to the school, carry virus and give it to the younger sibling. This is a common story. So make it sure that if you have a child in home with a chronic infection, reverse isolate him. That means you follow precautions, let him be a little bit free, and don't kiss and all those kind of a stuff. We can stop that.
Right. So one more question is, can we make mask a compulsion at least for 2 months as a precaution? As
So
doctor mentioned, the virus could be asymptomatic.
yeah, so now if you are compulsion as a mask, we as so again, we are not a public bodies to make a compulsion about using mask, but it is a standard hygiene practice. And just to let you know, during COVID we also had a season, you know, that just because of using a mask for COVID, just for COVID we use mask, and the chances of tuberculosis gone down by 50%. We used mask for something else and we got a result related to something else. So it is a standard hygiene practice. You can use it, but at the same point of time, there are a lot of concern related to using N95 mask. Kids are feeling a little bit of headache and all this kind of a stuff. The way they use mask, the way they change mask. So at this point, we cannot draw a conclusion of using a mask. But yes, if you really wanted to protect your child and you wanted to develop that hygiene practice, you can kind of advisable to use mask. They can use mask according to their will, as according to their parents' will also.
Fine, sir. So one more question which I have, it's like during the COVID, we used to go and give the test at the hospitals, and we used to get the reports after 24 hours or after, like 48 hours initially. But is it something like, when we go to the clinics, the how quickly that we would be detected?
Yeah.
It could be a generalized question.
Yes. So now there are two tests available currently. As I told you, one is called as a multiplex PCR and second is called as a BioFire. BioFire is little bit costly, but one of the standardized tests in the world. It is costly and there is no test developed for only human metapneumovirus. It is developed for most of the viruses, including human metapneumovirus. So you can do, if you really wanted to have a quick, you can go to the good hospital, because most of the uh, a couple of, I would say, big labs will offer this BioFire. You'll get a result in 4 hours for BioFire. And if you want, okay, things are fine and you are okay with the 24 hours result, you can go for multiplex PCR. You can ask them to get a respiratory viral PCR done. So the result will be available in 24 hours. Big hospitals and big laboratories, because small, they might not have this test available, or even if they say there is available, they might extrapolate to the other labs.
Understood. One more question is, kids who suffered from other infections recently, like FMH, foot, mouth, hand infection, etc., are they more vulnerable? Like
So
age group of 9 to 11.
yes, so anyone who had concurrent infections, like within couple of weeks, yes, their immune system is recovering. There is a chance that they might catch any infection once they are coming out of one infection. So yes, you take care of them for the couple of weeks when they are good, they are eating well, hydrated well, and then probably after that they will have the same risk of infection as the other population, because hand, foot, mouth disease, it doesn't cause major change into the immunogenic pattern of the body. But couple of weeks, yes, they're eating less, they have a uncomfortable food habit during this time, so they take a little bit of time to recover.
Right, sir. How can we differentiate from normal cough and cold to hMPV virus?
There is no differentiation pattern, but if you have a cough and cold, 100 kids have a cough and cold. If you ask me, I'm giving just arbitrary, 30 to 40% will have flu, okay, and 30 to 40% will have approximately, I would say, RSV virus, entero, rhino. 10% would have around adenovirus, and less than 5% will have a human metapneumovirus as the cause of cough and cold.
Fine, sir. And sir, during COVID, like we used to take a Dolo or paracetamol tablets, and if it is going forward, then we used to have some antibiotics in place. Then is there any recommended virus that you, as a first aid thing, or basically we have to use it?
So what I would suggest you is ki, in all parents, all infections, any child who's having cough, cold, fever, only 10% requires antibiotics, because influenza is not getting treated with antibiotics, human metapneumovirus or any virus. So only 10% of the kids require antibiotics if you have 100 kids related to cough, cold, and fever. 90% doesn't need antibiotics. In a 90% of the viral infection, there is only one virus we can treat on the oral medications or antiviral medication, which is influenza. There is a medication available, Fluvail. There is no medication available for any of these viruses. If you have cough, cold, and fever, coryza, fever. So for fever, you can use your paracetamol, age-appropriate doses. Cough and cold preparations are available in the market. I am strongly against all cough and cold preparations, specifically for the kids less than 4 years of age. Other kids more than 4 or 6 years of age, depending upon as your primary pediatrician suggests, you can use cough and cold preparation. But personally, if you ask me, I don't use cough and cold preparations because most of these preparations are not available in North America or US because they are not standardized taste test medication. So according to your question, so there is no medication. If there is a fever, you can use paracetamol. See for 2 days. If the fever is persisting more than 2 days or any point of time, child is looking weak, not accepting orally, breathing issues, you feel something is uncomfortable in the child, kindly contact your primary pediatrician.
Not sure. So one more question I have got it. In Telangana today, there is a news that kids are not recovering from cough and cold caused by mycoplasma pneumonia in spite of giving antibiotics. Is that true?
Yes. So I was going to talk about it once we finish this viruses. Yes, mycoplasma is troubling us since last 2.5, 3 months. So what is this? This is another bacteria. This is not a virus. This bacteria is supposed to infect less than 1 year, more than 10 years initially, or adults. But nowadays we are seeing 3, 4, 5 years of kids are also getting this mycoplasma. And what happens is this mycoplasma, again, cough, cold, fever, high-grade fever can be there, and it is causing pneumonia on the X-ray. I have seen kids where there is a fever, but there is no cough, there is no cold, no breathing issues, and you get a chest X-ray done, they are having a pneumonia. So both the things we are seeing it. The reason the medication which was available for mycoplasma and which was really used to kill mycoplasma bacteria was azithromycin. But we know that there is a lot of abuse or misuse of azithromycin has happened over the time. And let me tell you, most of the parents agree if they had something, if they have a cough, cold, fever, if they have azithromycin available at home, they will take it. And 2 days, 3 days. And because of that, what happened is this mycoplasma has developed some resistance related to azithromycin, which was a very good drug. Now we have a couple of drugs available for mycoplasma, but we are giving those drugs after doing the viral PCR. The same PCR I was talking about, the multiplex PCR. So for all patients coming to our hospital, we do bacterial and viral PCR and identify the organism and treat it accordingly. It is not about just mycoplasma. There is a streptococcus pneumonia and H influenza bacteria is also coming. So whenever you have fever, cough, cold, or breathing issues which are actually persisting longer, kindly visit your doctor. Ask them for this viral and bacterial PCR. So to diagnose what bacteria we are treating, so we can target the treatment related to those bacteria rather than just getting the treatment. So yes, mycoplasma is troubling, but if you see the number of cases of mycoplasma in the last month has gone down. We are not seeing it more frequently now.
Thank you, sir. Namaste, sir. Any food items to be consumed that can help the child to improve the immunity system?
So what I would suggest is everybody knows a lot of hydration. You can include fresh fruits, vegetables. You can have a dry fruits. And most of us know that they are actually immunity booster food. There is no specific food which boosts the immunity, but there are ingredients of the food, as we said, antioxidants, multivitamins, which boost your immunity. And if your child is getting frequent cough and cold, that doesn't mean the child had immunity related issues. What I wanted to say is immunity related issues are big issues. That means your child is having less power to fight with the infection. Those are big issues. You will get pneumonias, you will develop brain infections or pus. All those things are different. So basically, if your child is getting recurrent infection, it's okay to have one infection every 1.5 months, which is having fever, mild cough, cold lasting for 3 to 4 days, which is absolutely fine. 15% of the kids can get one infection every month, which is also fine. But if it is not requiring any admission, not developing any pneumonia, not having any breathing issues, absolutely okay. So eat healthy food. Probably, I would say absolutely avoid outside food.
Okay, sir. So one is a general question. What is your view on tablet DART, either for kids or adults?
Actually, I'm just searching what is DART tablet. What is this DART tablet? I'm checking it, what exactly it contains. Okay, so now I saw that. I strongly disagree with this combination treatment. It has paracetamol, pro, profenazone, and caffeine tablet. I strongly disagree for using this tablet for adult as well as pediatrics. If there is a fever and pain, paracetamol. If there is a cough and cold, there are medications available for that. You cannot club all the medications together.
Is there any truth to the reports going around that hMPV would have infected most children by age 5 and therefore would have developed immunity against it?
So there is no research or recommendation related to that, because how do we identify they have developed immunity against? It is not a one-time infection. That means, like, you just imagine like a chicken pox. Once you get a chicken pox, the antibodies for chicken pox will stay there for 20, 30 years. So it is not like that for human metapneumovirus or influenza virus or RSV virus. They vanishes rapidly. So this report is absolutely wrong. And second thing is, there is no way we can check the human metapneumovirus immunoglobulins in the blood. So, but it is true that some way around we might have encountered the human metapneumovirus. Whether we have developed the disease related to human metapneumovirus or whether we have developed the immunity related to that, it is very difficult to say unless and otherwise we do a test for that child or that adult.
Yes, sir. So one more thing, sir. If we encounter any children coming to school with cold and cough, I'm sure that most number of the children do come in, and after identifying, we do send them to the infirmary, and we do again request parents not to send them. When the children is with cold and cough, but we see most of the children do coming into the school and attending the classes. During that point of time, I know that the children can't even wear the masks all the time. So what would you think that in a school ideally be doing at this point of time?
I would say this question should be directed to the parents rather than nurse. So what nurse is going to do, she is going to ask and tell use mask. So if you feel the child is having cough and cold, mild cough and cold, there is no fever, and child is big, like I would say 6, 7 years old, you can encourage him to use a mask. Okay, because it is not just a question about us. Everybody is worried about everything. Forget about human metapneumovirus, other viruses also there. So you can encourage to use mask. If you have a support system at home, you can keep the child. If they at home, yes, that is also advisable, because it's not like that your child is infected, he can encounter another virus from the other child also. That is also possibility is there. Now, second thing is, if your child is having high grade fever, cough and cold, yes, definitely you should not send them. Any child who kept on getting, there could be a possibility of some allergic cough and cold which is not infected. Yes, that possibility is there. There will be a strong history of. So in that situation, they can inform, probably I would say infirmary or school teacher, that there is a cough and cold and he has some allergic tendency. So please, okay, because I know sometimes both mother and father might be working and it's a desperate situation. Yes, I think so. School also things, and as a father also I understand this. In that situation, you can encourage to put a mask. That would be advisable. And second thing is, uh, what I seen during the COVID, if you tell them the reason very properly, this is the reason, they will keep the mask. They will not probably do any deviation from what you have told or what teacher or anybody is saying at them at school.
Right, sir. As kids eat in cafeteria in school, any precautions will be taken? Any suggestions?
Yes, so now at this moment, there are no recommendations like COVID. We had at least, I would say, 3 feet of distance, no kind of a one-to-one communication, or if any COVID positive patient was there, you cannot stay in the same room. Those skills we don't have, or those recommendations we don't have for him. So at this moment, what I would say is, um, currently continuing the cafeteria practice, but yes, if we can actually a little bit, I would say as a precaution way kind of a thing, segregate a little bit of chairs if it is possible, that is okay. But there are no recommendations. This is just out of fear. Everybody is kind of talking about it.
Got it, sir. So, do you think that any kind of further announcement do we able to come again in
Yeah,
near
what I would
future?
suggest is, if we start getting any reports like it is fatal, and some most likely, I believe somebody might be doing a work on that, whether there is this human metapneumovirus is different than the previous one. As I told you, antigenic shift and drift. If we start getting that kind of an information, and if we see outbreak means we see every hospital is kind of getting this patient again and again, then we should get probably worried, or we should start becoming kind of going on a foot war kind of things and making it sure that things are absolutely same as COVID. But at this moment, there is no results. Forget about media. Speaking with most of the prominent hospital in and around India, there are no such things are happening at this moment. As I told you, I am directing this session more than a human metapneumovirus. I want you to take care of the other viruses, including mycoplasma. Okay, so influenza, RSV, enterorhino, adenovirus are more worst and bad viruses than this human metapneumovirus.
Thank you.
And mycoplasma, which is again causing the trouble in between.
Yes, sir. I guess I've completed with my question and answer sessions, and I'm sure if anyone of you again have some questions, please post them so that I can ask Dr. Parag. And meanwhile, Rizwan sir, would you like to have anything?
Nothing, sir. I think it's quite clear. The session has given us a lot of information. I think whatever is not just for hMPV, even generally, we need to take certain precautions. And I would like to assure all the parents here, whether it is TSUS or TSRA, we will do everything that we can, any measures that we need to take to ensure our students' safety, our staff members' safety. So we will wait for further directions from the government if there are any developments, and we will take precautions accordingly.
Yes, sir. Thank you.
There is one question for
Yes, sir. Yeah. For mycoplasma, are the symptoms same as cold and cough?
So mycoplasma, yes, it can cause cough, cold, fever, breathing issues, some chest pain. Sometimes you can just get a high spiking fever, which is lasting more than 2 days, no cough and cold symptoms, unless and otherwise the pneumonia becomes bigger. So the general principle is when to visit your doctor when the fever is persisting more than 2 days, or at any point of time, cough and cold is compromising your daily lifestyle, like you are not able to sleep, not able to eat because of cough and cold, or you started having a breathing issues, or a lot of parents have that oxygen monitor at home small. If you see the baby is breathing faster, oxygen is going down. So you should definitely visit your primary pediatrician.
Thank you, sir.
Thank you, Dr. Para. I don't think there are any more questions. Thank
Yes.
you for the session today.
Yeah, thanks. Take care.
Thank you, sir. Thank you very much. Thank you, all the parents.